They're gaslighting you and you're not crazy. You're going to want to watch the full video. Let's get into it. I've got to sit down. I've got some serious things to tell you. Okay, we have a lot to get into. My name is Julie Catherine, and the reason I'm bringing this all up because we need to talk about this even more. How doctors and the medical field is trying to gaslight women over 35, making them feel like perimenopause and menopause and all these symptoms that we have are other reasons. So a little bit about my personal story and why I'm so passionate about it. I was 37 years old starting to have issues with perimenopause, but however, I had no idea that's what they were. I ran like a typical person to my OBGYN. I was lethargic. My hands hurt so bad, like all my muscles and especially in my joints was hurting really bad. I couldn't really focus very good. I had anxiety through the roof. I kind of felt like I had some depression. And that was at 37. And most typically when you go into your OBGYN or even your primary care physician, they kind of just want to sweep you under the brush and say, you're healthy. I worked out a lot. I was a lot thinner than I am now. I didn't smoke. I didn't really drink. It was like, I kind of lived a normal lifestyle. And they were just like, oh, it's just because you're just so busy with kids and this and that. And you know what? Just take care of yourself. I mean, it is the craziest gaslighting you will get. And it's an important conversation that we have. And we need to get the message out even more. We need to be louder about it. We need more funding. We need more research. We need more doctors to understand perimenopause and menopause symptoms and how it is killing us, literally killing us. I was 37, like I said, went into the doctor complaining about all these things that were going wrong. They took my blood test. It was a female doctor, and it came back and she said, well, there's some few things that are a little low, but everything else seems pretty normal. And I was just like, well, I don't understand. There's something wrong. Well, we're going to send you to have your hands looked at and your joints. Well, then, off that went. And then she was like, you can go and talk to a therapist and maybe that can help you with, your depression or your anxiety. So there I went for another appointment. And the end all be all, it was perimenopause symptoms. And one of the doctors that I've kind of followed, and that she's got a pretty big presence on social media, she had said it's very important to find out when your mother went through menopause. My mother did not. She had a full hysterectomy at 41. However, she said if your mother is not alive or if you don't have one, check with your aunts that are closest to your mother's side of the family, even a grandmother. That should kind of tell you where you should start looking. The next thing that I spent several years not knowing what the hell is wrong with me. Those symptoms progressively got worse, and I started adding in more symptoms. We are going to talk about the symptoms in a few minutes, and I have a laundry list of symptoms. At 47, I went, and I probably honestly went through it around 46 because my periods were always kind of like 3 or 4 months of not having one. That was kind of normal for me. I probably went through actual menopause, which is basically 12 months of no periods, consistently no periods. So I might have went through it at 46. All I know is I was so bad, so depleted, so tired, the brain fog. It was like it was gradually getting worse. It was like more symptoms being added, and some of the ones were just out of control, like anxiety was out of control, mood swings out of control, hot flashes. I mean, they would be here and there, but not like some of my friends would talk about hot flashes, the soreness in my muscles, bunch of other things. And I finally was like, called one of my friends. I have two older friends that are, one's 10 years older than me. I'm 52. I went through it at 47. So she's 62 now. And another one that is 56. She's 4 years older than me. Anyways, they went to this doctor, and she was like more of a hormone specialist. She was an OBGYN. also, but she really dedicated more of her practice to hormone therapy and helping women to optimize their health. And I just remember hearing their story and the stuff that they were taking. Really didn't put two and two together whatsoever. All I do is remember I woke up one morning because I haven't slept all night long. My eyes were wide awake. I was miserable. The night before, I only slept like 2 hours. It was, like I said, it was getting worse, and my depression was getting even more worse. More worse? I don't know. That's not a word, but you get what I'm saying, right? So I called the number, and they said I had to do a blood panel, and they said it would be, they didn't have a next appointment for 3 months. I about went ballistic, and I was crying on the phone, and I remember her saying, do you want to put your name on the list just in case of, somebody can't come in? And all I know is she said, go get the blood panel now and we'll get you in. And all I know is she called maybe like a week later and said, we had an opening. Can you come in tomorrow at 10? And I was like, I will be there. From that point on, my life turned around 150%. I can't even explain to you how my life really changed with being under my doctor's care and her specializing in hormone replacement therapy and having an optimal life. And the things that she shared with me, I was blown away that I'd never heard another doctor talk about. And my doctor, like I said, I went to my OBGYN. I asked her, could it be anything else? And she was like, no, I don't know, sweetie. You might have arthritis, which I went through that whole thing trying to figure out what was wrong with me. Had to get on antidepressants. They put me on arthritis medicine. It was crazy how many medicines I had to be on. I finally just one day was like, I'm not taking any more of these. And probably 3 years later is when I actually went through menopause. The reason I'm sharing this with you and why I feel so passionate about it is because women deserve to have an informed, educated discussion about menopause, about perimenopause, and about hormone replacement. Not every woman is going to decide to take hormone replacement, and that's okay. As long as she's informed with the risk and the benefits, she can make her choice. And this is why I think it is so important. Talk about perimenopause and menopause and the difference between the two. Because I was watching this girl, or it's not a girl, this lady, she looked close to being my age. She might have been late 40s. I'll put a picture of her YouTube that I watched. And I think she might be entering in, she definitely has some perimenopause symptoms, but I think she's starting to enter into the menopause. And she was just like, well, I don't know, my mom, did it, and I'll just do what she did. And I'm thinking, oh my gosh, I've got to make a video out here trying to help as many women and educate as many women as I can. So to define menopause or perimenopause can start roughly around 35. Yes, 35-year-olds can have perimenopause symptoms, okay? She said they can last 7 to 10 years. This is why it's so important to understand perimenopause and the symptoms you are having and you not to be gaslit anymore. And for you to be an advocate of your own health with your doctors that you do use and to ask certain questions. I will be having some free resources that I will be linking down below. I will be talking about them so you can get educated as much as you want. So let's move on to menopause. What is menopause? Okay, so menopause is when you have 12 months of no period consecutively all the way. Now you could start having periods and miss 4 or 5 months, or have a really heavy period and then another one and then miss 2 or 3 months. And that could kind of go on for a while. It means your body's trying to make that change. So just know after the 12 months, you were fully in menopause, and you can experience the symptoms that I'm about to discuss for like 7 to 10 years also too, along being in, if you don't do this one thing. Your symptoms when you're in menopause, all the hot flashes, all the stuff can definitely last up to 12 years. That's the number I'm looking for. Crazy to think about. And when you think about like my mother and her grandmother, they just kind of strong arm in it. And that we have so much new information out here that is going to help you live an optimal life. Like, we decline as we get into menopause. You start seeing this as your life expectancy, like the quality of life. What we're trying to do is level it up and keep it consistent. That's where we want it to be. So breaking some of the stigmas that come with perimenopause and menopause, and the confusion and the gaslighting and the I don't know what is going on with you. You don't need anything. You don't need estrogen. I literally saw on TikTok, this lady said, I do hormones naturally. There is no real natural. She said, I take these 3 supplements and I lost weight. That is not going to be healthy for you. And yes, you can lose a few pounds and feel good, but that is not what is most important for us, and why we're experiencing all these symptoms. So let's talk about the symptoms. Menstrual cycles change. They'll change. They'll start getting heavy. You'll be spotty. You won't be your 25 days or 28 days, whatever you're regular. You will start to be not regular. That is a sign. Also, hot flashes, meaning it could just be all of a sudden you're flustered. You just get hot all of a sudden, okay? That's one of the things. And you can be in bed breaking a sweat for no reason. Those are hot flashes. Those are perimenopause symptoms. Night sweats. You can just start sweating for no reason. Absolutely no reason whatsoever. And it's not just alcohol making you sweat. That is a symptom. Vaginal dryness. This occurs. Did y'all hear that story about Halle Berry? And then she went to the doctor and she was having a breakout, which she thought was herpes at the time. And her doctor gave her a diagnosis of that. And she started freaking out with her boyfriend. And then she started looking into it. She has like the top doctors. And this was only a few years ago. I want to say like 3 years ago. It was astonishing. It came out after her digging, and she's calling her doctors and he's telling her he didn't do anything. And she was like, could it be anything else? And he said, because she was having all these symptoms. And they were like, no, it could not be anything else. It's absolutely crazy. She had said she started digging around and started finding articles and videos and some discussion about vaginal dryness and what it could do. And being, because she was older, she was in her late 40s, that kind of started spiraling. And then she called her doctor, and then they started investigating together, and she found out it was a perimenopause symptom. She was low in estrogen. So just know that it's not just doctors that you feel like are not highly qualified. It's higher up doctors that know a lot. It's happening to everyone. She said she was gaslit for years about some of her other problems that were coming up. So urinary changes, you frequently need to urinate, or you all of a sudden are leaking, like even exercising when you're jumping around and you start to leak, that is a sign of perimenopause. Yes, joint and muscle pain. Did you know 82% of women experience joint pain and they think it's arthritis and need to take arthritis medicine? Well, what are we doing to these women? Changes in your skin, dry and itchy skin. I had this later. It was like if you feel like you're coming out of your skin, like it was just like, I hated like my skin. It was just itching all the time. And there was literally nothing wrong with it. Thinning hair. Yes, your hair will start to thin. It also will have a slow growth pattern. So my hair, I just got it cut. So I got it cut about 2 inches. I couldn't grow my hair out. I literally, if you feel like that and it's stumped to here, and you feel like you're thinning, because a lot of time you'll thin up in this area in the front. If you feel like that, you are definitely in menopause. Your estrogen levels are diving fast. Yes, weight gain, especially around the abdomen. The abdomen is where you're going to gain most of your weight. You're going to feel pudgy. You're going to feel puffy. And no amount of high intense aerobic running is going to lose that. It's a visceral fat. It's highly imperative we get that off. But no amount of running and doing this. And if you're one of these, I exercise and I eat right and I can't lose 5 pounds, you're in perimenopause. Breast tenderness. This is caused by erratic hormone levels. This is multiple, this is your progesterone, this is all your hormones starting to be really erratic. I started having that at the very end. I was just like, oh, they just hurt so friggin' bad. Anyways, this your hormones taking a huge dive. Panic disorder, you're just feeling out of control, you're feeling anxious, you don't know what to do, you're feeling like that. Mood swings are a big thing where you're going up and down. Did you know that 50% of the divorces that happen between 40 and 55 years old, all the women are in perimenopause and they are just going crazy? We need to fix this. We need more education with these doctors to help women like that out. Fatigue, I talked about this. I was extremely tired. Like you're just like, I don't know why I slept. Also, the inconsistent sleep patterns that we're having is causing some of that fatigue. And also it starts causing a lot of brain fog too. Headaches. Headaches are a huge hormone fluctuation. A lot of people, especially when you get closer to your period, you're probably going to blame it on that. And if you're in this range of 35 to 50 years old, just know it's not that. Brittle nails, brittle hair, always feeling like you have fried looking. My hair looks super healthy now. I always I felt like my hair never looked good. My nails would never grow. They were always super short. They always were fragile. They were always breaking. Also, frozen shoulder is a huge one. I'm seeing a lot more women talk about that, and this is a perimenopause. It starts to get in your joints. You have a hard time moving, and then guess what they want to do? They want to send you to physical therapy. That's just the tip of the iceberg of what kind of symptoms we're having. Drop me a comment in below to let me know your kind of symptoms you have. I would love to hear from you because not every woman is going to have experienced the same level of symptoms. There will be some different ones. Like I said, I think there's almost 100, I think 75 or 80 of symptoms that are included under this. So please share your comments. Please share your stories down below. We need to have open dialogue about this. And it's no longer going to be a hush topic anymore. So we're going to talk about breaking the stigma a little bit and addressing the misconceptions. The misconceptions is just like you go to the doctor and they try to gaslight you about all your symptoms. You need to go here. You need to see a therapist. You need to get on antidepressants. You need to go and get whatever, physical therapy. You need to use Nutrafol. Stop using all that. That's not the reason. We can. I don't use Nutrafol. I don't use any of that stuff. I'm telling you, your hair and your nails can grow, and your skin can be glowing for sure. I will let you know any of the secrets I use, and they're not even secrets. We want to normalize the conversation and be able to talk to women and freely and not feel judged. Because I feel like sometimes people say you're in menopause, you're old, like you're going to die. And yes, you don't take estrogen, you're not going to live a healthy life. So yeah, we really need to have a more open dialogue. And this is just going to help everybody when they go into their physicians and need a little help. This is going to help you be educated and be able to talk to people. But we need to talk to people without being judged, even if we're 35 having these symptoms. We need to be able to talk to women. If I wasn't there experiencing what my two friends were going through, I wouldn't have found this doctor. I don't know where I would be, honestly. I was so miserable, like out of my mind miserable. I can't be any happier. I feel so good. I feel alive. I feel way better than I was at 35, if you can believe that. The biggest thing in menopause is our estrogen levels start to dive. They dive, and once you hit menopause, they plummet. Like the line is like this. That is what's really creating even more havoc on ourselves. I think I heard a quote that said, perimenopause wrecks your mental health and menopause wrecks your body. That couldn't explain it even better. It's crazy how this does. When we don't have ample amount of estrogen in our body, what happens to us? We have no protective barrier for cardiovascular, osteoporosis, colon cancer, Alzheimer, diabetes, insulin resistant, hip fractures, coronary artery, and visceral fat. This is if once we get to that and we're not supplementing estrogen, this is what happens. The number one death of women is heart attack or stroke. It is not breast cancer, y'all. I hate to break it to y'all. It is not breast cancer. They're finding out new research that estrogen is not the cause of breast cancer. You do need to talk to your doctor and have an open discussion if you've had breast cancer in your family or yada yada. So I'm not a doctor by any means. We live a third of our life in postmenopause. Now, once we hit menopause, like I said, the estrogen level goes down and you will start to feel just depleted. This is why we need estrogen. The longer we go without estrogen, the worse our bodies will be. If I was 37 and they diagnosed me with some estrogen loss, like I had perimenopause, I could have been put on an estrogen hormone replacement for that. And just a small dosage would have helped me. It would have went a long way. It would have protected my heart, my cardiovascular. It would have kept me from being insulin resistant, visceral fast. Like I said, I started gaining weight in my stomach really easy. And all those are just highly detrimental to us as women as we get older. They did a study, Journal of American Medicine Association said, they found a new study that when they took estrogen, they had found lower rate of cardiovascular and a lower cancer rate and a lower cause of all mortality, meaning all those other things I talk about when they had the estrogen replaced and they had it as soon as they started with the first few symptoms. Time away from estrogen equals when diseases start. Inflammation starts building up and then all sorts of diseases start happening. So in 2023, 85% of women complaining of menopause symptoms, only 10.5% are receiving treatment or therapy. That is scary. That is extremely, it's not even that long ago. That is extremely scary that 85% are reporting symptoms, but only 10.5% are receiving some type of therapy. That is very scary. If you're in menopause and you fall, because hip fracture is a thing. So if you fall and break your hip, 30% of women will have it looked at and have surgery. 70% of women won't, and they will die within their first year. I mean, is that not astonishing? And it's because of estrogen loss for too long and not having enough muscle mass to support our bones. What happens is over time, it starts chipping away at our bones and starts decreasing our bone loss. That's why it's so easy to fracture our hip, our knee, or fall and break a leg. Those are highly, highly susceptible to happen once estrogen loss is tanked and you don't resupply with, or you don't have therapy of estrogen or progesterone. I'm going to share some free resources with you. I get a lot of information from Dr. Mary Claire Haver. She's a board certified obstetrician. She is a menopause specialist and some food, I don't know, she got a food degree too. Also, what is her name? Heather Hirsch. She is another one. She is on Instagram. She is on TikTok. She's here on YouTube. I wanted to make some kind of long form content, so we have it out here, but that is another one to look at. She has some great information. You can start just kind of looking at some of her short form content or a long form content. You can watch their videos when they have done podcasts with other podcasters. Also, look into their websites. They have great website. The Pause Life has some great information. It also has where you can find doctors. So if you're looking for a menopause specialist, you can always, she has it on her website on the Pause Life. You can just read it, but it is a menopause.org. You can put in where you're at. It's supposed to give you doctors in your area that are menopause specialized in what they do, which can help. Also on Pause Life, I know at the bottom, if you want to go through there, there is another list. Women have put their doctors in that list. So that's another helpful way to find, doctors where you're at. MIDI Health is a great one. If you're not close to any doctors or you just want to do an online, MIDI Health. So a fun, interesting fact I found out, MIDI Health was in the Forbes magazine. They are predicting this is the first female-owned company that will hit $1 billion in revenue. I absolutely love that. Alloy is another great website. You can find stuff. If you're interested in really reading about more about different studies, so you can go to pubmed.com. It's basically a Google search for anything medical that they have found. It's a great one, but obviously they've done a lot of studies. You got to read it up, but I want you to be informed in any way that you can. The best way that we can have an optimal perimenopause and menopause life is number one, and to start eating right, eating more protein. They have found when we keep our muscle on, that helps protect our bones. If we fall or if we get in a wreck or anything like that, they have found out that we need more protein. It is not a low, like you need more protein. I'm trying to get in almost 100 grams of protein a day, and it is kind of difficult. I'm not going to lie, but I'm doing it and I'm already feeling better. You also need to be on more of an anti-inflammatory diet, meaning the Mediterranean diet, eating things that are clean, eating lots of fiber. We need more fiber to eat fiber, not a supplement fiber. You can supplement, but you also need to be eating more fiber. Also drinking a ton of water, having electrolytes are going to help you. We also need to start working out with weights. Yes, weights. We need to stop so much cardio, just straight up cardio. You need about 3 days of weight training and 3 days of walking. You can simply walk. You can also do it with a weighted vest. That's another way you can get. Weighted vests are great for bone density and helping build stronger bones without necessarily lifting weights. Now, Dr. Mary Claire Haver says she wears a weighted vest as she does legs and stuff like that for resistance training. Also walking helps reduce the stress. It's just another inflammation marker. It adds to a lot of inflammation that we don't need on our bodies. It's also important to get sleep. Sleep will help recover the body. I want y'all to have an optimal life. I want you to live longer and stronger. I want to live till I'm 97 by myself. I want to be able to clean dishes and fix my own food and drive my own car. I don't want to be tied down to somebody to happen to take care of me. Dementia with women, they're finding women with no estrogen that decided not to do any kind of estrogen therapy. They're starting to develop dementia in around 70 something years old. That's a little scary. I don't want to go out like that. That is a very sad way to go out, and it's very hard for people to watch their loved ones go through that. So I will have a bunch of resources down below, how you find your doctor, where you can find them, and also a couple of questions if you want to go to your regular doctor and they kind of feel like they're gaslighting you. I will have a couple of questions, follow-up questions, how you can maybe find out if maybe they can refer you to somebody, because sometimes just that open conversation with a physician, they realize they aren't making the best decisions for you and maybe can help you find a better provider that can help you. So hopefully, I know it's been a long video. Thank you for staying here, but I hope you find this beneficial. I hope, like I said earlier, make sure you leave your comments below and let me know your story, your symptoms, anything. I'm here. I want this to be an open dialogue for everyone, and we're not judging anyone that want to take hormone replacement or not. We just need to be more informed so we can weigh the risk factors out. So that's all I have for today. Make sure you like and subscribe. I'm building a community here of you kind, warm, loving women just like yourself. Until next time, bye.